So I'm originally from Toronto, Canada, and I did spend some time on the East Coast here in the US in Philadelphia. I mean, I started here as a travel nurse and I came here and I fell in love, and it's 5 years later and I'm still here. He was born with pulmonary and aortic stenosis and an atrial septal defect. He had his surgery 12 days ago. So overnight we'll be working on getting his lungs optimal in the hopes to extubate him tomorrow. Good cough. I recently transferred to critical care from the emergency department, and it's a completely different environment. The skill set is different, the patient population is different, my day-to-day activities are different, and I've been on orientation for 4 months now.
Is that good? Okay. Oh, I see what you mean.
They give you a lot of education. There's a lot of opportunities to grow within the department, within the organization. He's at 3.9 cc's per kilo per hour for his 24 hours. This hospital really supports its staff and its nurses to make the best decisions for the patient. And his MAPs they've wanted to keep it above 45. On the epi, he was above 50, and so we've titrated it down, and now it's off, and his MAPs have been low 40s to high 40s. We do have, as nurses, a lot of autonomy, and we use a lot of our critical thinking skills to kind of help guide what we're doing. A little after 8 o'clock, because it was right after shift change that he started getting really hypotensive. There are parameters that are set for us and orders that the physicians put in, but then within that we have flexibility so that we are using our own judgment, our own clinical skills to determine what to do for the patient. You're awake. What time is it? You should be sleeping. This is an awesome place to work. We have a brand new facility, top of the line technology. We perform like groundbreaking surgeries here. We do a lot of research here, so we're always trying to advance what we do in terms of the techniques that we have. Like some of the surgeries that we perform here in the cardiac ICU are not done in many other places in the world, in the country. So you don't feel like you're just kind of coming to work, coming to a job. This is more like a career. This is a place that you can flourish, you can stay here a long time and grow within the organization and have lots of opportunities to, advance. All right, let me just pull up this chart. It feels good to come to work in a place that, you're supported and you're making a difference.